I think that for me, as a person who sees patients who are nearing dialysis and struggling with that decision, I don't want to ask my son or daughter to give me a kidney. I don't want to ask my mom to give me a kidney, to be able to say like, hey, look, I did it a month ago and here I am. Would you know? No, you wouldn't know. So I think just having said that, I can say, look, the thing you have to ask, I know it's hard, but it's really, you're not asking for something outrageous. Like, I did it and it's fine. And that was really the best part of it for me.
Extraordinary people in our community, I would say, are positively Milwaukee. I'm excited to have you join us. PozCast. Thanks for pausing for the PozCast. I'm Shannon Sims, and I am excited because today's episode, I really want to say, is all about walk the walk, and you will find out why. Now, we're going to get a little education here because I have Dr. Gaddy, who is a nephrologist at the Froedtert Hospital and Medical College of Wisconsin. And first, we're going to have you're going to teach us, a nephrologist.
Yes.
Tell us, what do you do?
If you don't know what a nephrologist is, that's great for you. It means you haven't needed us. But a nephrologist is a doctor who deals with the metabolic functions of the kidney. There's also urologists who deal with the structural and anatomic surgical issues regarding the kidney. So if you have stones or a kidney cancer, you've probably dealt with a urologist. But nephrologists deal with when people have chronic kidney disease or problems intrinsic to the metabolic functions of the kidney, meaning the kidneys can't either detoxify your blood or they can't get rid of the salt, water, or other compounds that you take in. And so your kidneys struggle with actually cleaning your blood. So that's what we do.
So is it fair to say that the kidney is kind of like this silent general in your body?
Absolutely. Your kidney is in control of everything in your body. And it's very easy to forget that they're even there because they usually do their job so well.
All right. And you do your job extremely well. What was the gravitating pull to becoming a doctor who specializes in kidney function?
That's a great question. When I was in medical school, we did physiology sections, and the kidney has the coolest physiology to me. There was just something about it that grabbed me. And the kidney really doesn't, it's magical in that it takes all of your blood and it cleans it and it makes your input and your output exactly what they need to be. So it can take a lot of things that are thrown at it and sort of mysteriously turns your blood into normal. And I just found that really mysterious and interesting. I thought it was the hardest part to understand, and so I thought I'd always be interested.
So you were fascinated by this little bean. Is that why you call yourself the bean queen?
Yeah. Oh, no. Yes, that is why. Yes. Yeah.
But in all seriousness, the reason why I thought it was so interesting to have you on is because you are so passionate, not only about the kidney function, but about talking about live organ donation. And why? Because, girl, you decided a year ago that you were going to give your kidney away.
Yeah.
Explain.
Actually, so, to you or to other people, it might seem really bizarre. And a lot of people donate their kidney because they know someone who needs one. And I think when you realize how impactful it is on that person's life to have to be on dialysis, for example, you see an opportunity to help. But in our culture, we really just don't talk about our illnesses. And so you probably know people that have chronic kidney disease and they just don't talk about it because it's not a pleasant thing. Whereas I sit in an office all day and see people be impacted by it. And I round on dialysis shifts where I see patients who, have to spend 4 to 5 hours of their day, 3 days a week, because they're stuck on dialysis. And so to me, it's something that it was almost how could I not? Because, I just see the need, and it's just a way that I could help. So it's just, you see the need that's in front of you.
So you saw the need, but Dr. Gaddy, tell me what happened the day you woke up and said, I'm doing it.
I really don't remember. I remember I was at a conference and I thought, I had been kind of thinking for a few weeks, I guess I really have never considered why there's really nothing stopping me. And so I just put in I actually donated at Froedtert where I work. And so I had put in a request through the patient portal online. There's a website and you can just kind of ask for more information. And I got a call. And so I just kind of asked questions and found out what it would be like to do that. And there was just never a point that I thought I can't do that. So there wasn't a reason not to.
So can you explain kind of the process and the recovery? Because I'm sure people get really scared when they talk about surgery.
Absolutely. And I think that was one of the most surprising things for me because this isn't what I'm not a transplant nephrologist, and so I don't really see patients go through the donation process. So as I said, donated at Freighter because that's where I was most comfortable donating. I went in for about a day worth of testing. So there's some blood work. They do a CT scan where they basically just put you through a scanner and look at your internal organs, make sure that you actually have 2 kidneys, that everything looks normal. A lot of people don't, and you just don't know that. And that the blood flow is good to both so that they're not accidentally taking, one that doesn't have good blood flow, et cetera, et cetera. And then there's like a good screening about, there's a psychological screening, making sure that this isn't going to impact your job in any way, making sure they talk to you about insurance, things like that. But it was really just a series of kind of talking with them about what the procedure was. And then I had blood work done to see who would be a match because I did a non-directed donation, meaning I didn't have a person in mind to receive. It was just sort of out to the world. Mm-hmm. And so I waited to hear that someone was a match for me. And then once they were a match, we scheduled surgery. And surgery was, I went in that morning. It took, I was asleep a couple of hours, I think. And really pretty easy. I mean, I got up and walked around that afternoon, tolerated food by that afternoon, and I went home the next day. Wow. So there was some monitoring of just making sure that my kidney that was still there was working. Mm-hmm. And I had taken a few weeks off of work just to make sure, but I went back to work 5 days later. And I don't have a very physical job. I wasn't lifting or anything, but I was just kind of bored, so I went back. But yeah, I felt great. You do have lifting restrictions, like nothing over 30 pounds for, I think, 6 weeks. So, if you had small children or heavy things to be lifting, like I did a little prep work. But yeah, unfortunately, it was during that blizzard we had last winter. So I had to have friends help me shovel.
That's not a bad problem to have.
I was not upset. Yeah. But yeah, it was a really, I was very lucky. And to be honest with you, it's not an atypical experience. I never needed narcotic pain relief. I just used kind of cold packs, and I don't have a very high pain. It's not like I'm a very tough person. So it was really quite easy physically. I think that for me, as a person who sees patients who are nearing dialysis and struggling with that decision, I don't want to ask my son or daughter to give me a kidney. I don't want to ask my mom to give me a kidney. To be able to say like, hey, look, I did it a month ago, and here I am. Would you know? No, you wouldn't know. So so I think just having said that, I can say, look, the thing you have to ask, I know it's hard, but it's really, you're not asking for something outrageous. Like I did it and it's fine. And that was really the best part of it for me.
And as you were talking, there's just like this S hologram that's behind you, because I'm like, you are a superwoman for doing this. And did you ever get to meet the person you gave the kidney to?
I didn't. So they ask you, when you do this, they ask you all your personal information's voluntary to share, outside of course, like infectious disease status and things like that. Mm-hmm. But I said, you can share it with them. I felt like it was a little, I just thought that might be a strange dynamic. My recipient did actually write me a letter, which was really sweet. So I found out, some basics about him. And as a nephrologist, I was very curious just to kind of know what his cause of kidney failure was. Mm-hmm. But it sounds like he's living a really healthy, thriving, which is great to know. I mean, I had that faith in the system, and I, as a nephrologist, kind of know how organ allocation works, and I know how rigorous that application process is to make sure that the people getting the organs are healthy and able to live a good, healthy life afterward. So I knew that my organ was in good hands with that system, but it was really nice to get that validation. So
yeah,
so
I know
really
that
nice,
must have felt really good.
It did, yeah.
Live donor donation or organ donation, is it a hard sell?
Not if your loved one is asking you, but I think non-directed, it's one of those things that, again, I think people just don't necessarily know how big the need is. And I think they also don't maybe realize that it is a really doable thing.
What are some of the live organs that one can donate?
So you can donate a kidney. You can donate bone marrow, either via peripheral, just like an IV. And then you can also donate part of your liver. Yeah, so.
And you're still fine with one kidney?
I'm fine with one kidney, yes. So there are, and I think it depends on each person. It depends on how healthy you were prior. If this is something that you are going into, you won't be allowed to donate if you're not healthy enough to. So it's a very rigorous health screening. You can't have any conditions that would put your kidney at risk in the future. So if you're someone who's at high risk to develop kidney failure in the future, you wouldn't be allowed to donate. So I'm lucky that I was okay before and I'm okay now. It's not a zero risk. There is some risk that in your lifetime you will wish you had that kidney. But one of the things that I didn't realize before all this, and that many people have asked me, is, what if you need that kidney, or what if your family member needs that kidney? And that's, I think, one of the things that really holds people back. They're like saving their spare for something, which is reasonable, right? But I actually donated through a program called the National Kidney Registry, which gives you basically a voucher, and it's good for you or any of you can list up to 5 people. So if like my mom or my sister needed my kidney in the future, I could give them that voucher, and then they would go to sort of the top of the list in terms of getting an organ. So thankfully, that's not a big consideration for me because my family's healthy, but you never know, and so I think that's a nice insurance policy to kind of help with that sort of thing.
And just listening to you talk about the process, the function of the kidney, I was reading kind of like reviews of your patients, and everyone always says that, you speak so knowledgeable about the subject matter, that you make them feel that you care about their care. How does that make you feel when you know that your patients feel safe in your hands?
Humbled, I think, because, as doctors, especially as a doctor who deals with an organ that doesn't have symptoms, my patients are putting a huge faith in me. If I'm wrong, and I always tell people I'm at the beginning of my career, I'm not going anywhere for 30 at least years. If I'm wrong, I'm going to have to apologize to you in 20 years. And so for me, I don't take that responsibility lightly, and it's really hard to know if it's working or not. It's a huge act of faith. And so I do a lot of counseling and trying to help them understand like why I'm making the choices I'm making. And I try to share the studies that I'm going off of so that they understand what I'm basing my decisions off of. Because sometimes, kidney failure or kidney disease is a really aggressive disease. It's a really insidious disease. And some people are going to have, they're going to progress to needing dialysis regardless of what we do. And so I need them to feel like we tried the best we could. So that is very humbling, and I'm glad to hear that.
Well, I know some may have wondered, a nephrologist, Positively Milwaukee. But you see why I brought Dr. Anna Gaddy on, because she positively is changing how people relate to their doctors. You are giving, like you really do, as I said in the beginning of this episode, walk the walk. Yes. And I really appreciate that selfless act that you did. And again, you helped another life, and hopefully more people will be interested in live organ donation because of you.
I hope so. And I appreciate you giving us the chance to talk about kidney disease, because it is one of those things that if you don't get tested, you can't know you have it until it's way too late. So just really important that people talk about it, because it's not a very sexy organ to talk about for some people. For me it is, but for some people. And so I think, just the more awareness there is, this disproportionately affects people who don't have good access to primary care. And so it's just one of those things that please make sure you're taking care of yourself. And even if you feel okay, just go get checked out every once in a while.
Is there someone in your community doing amazing work? An unsung hero, or someone just with an inspiring story to uplift us all? Well, I want to hear from you, because I want to talk to them. Why don't you reach out to me with the email on the screen? And the next time you tune in, they may just be sitting next to me here on the PozCast.